You know how it is, you're scrolling online, maybe see a short video, and suddenly there it is. A seemingly simple fix for something complex, like a health condition.
Yeah, that happens all the time.
Exactly. And today, we're actually going to dig into a perfect example of that. It came from a listener's question to Professor Lin. A really great question.
Ah, okay.
So our mission today is, well, to unpack the science behind a specific claim, look at what Professor Lin advises, and really sharpen our critical thinking skills about health supplements, especially, for those of us without a deep biomedical background.
It's a really important topic. And it's true, there is genuine scientific interest in certain compounds, like vitamin B3 for conditions like glaucoma. Professor Lin definitely acknowledges that.
Right.
But, and this is critical, Professor Lin stresses that this isn't just some academic debate point. The details here matter a lot. Precision, understanding the nuances, overlooking them can actually lead to, well, potentially severe consequences.
Severe consequences for a vitamin. I mean, that's not usually what comes to mind when you think supplement, right? How serious could getting the wrong kind of B3 really be?
Well, that's exactly what our listener Elisa ran into. She contacted Professor Lin because her mother has glaucoma.
Okay.
And her mom saw this video, apparently from an ophthalmologist, suggesting vitamin B3 could help slow down glaucoma progression.
Ah, the online video source. Makes sense.
So naturally, her mom started taking it herself, about a gram a day, thinking, great, a non-prescription option.
I can totally see why she'd do that. That urge for a simple fix is strong.
Absolutely. But Elisa was worried, because the same video apparently also mentioned that too much could burden the liver.
So hope mixed with a bit of fear. That sounds familiar.
And Elisa's concern, Professor Lin confirms it's spot on. Yes, there are studies on vitamin B3 and glaucoma. Quite a few, actually.
Okay, so the video wasn't totally off base there.
Not entirely, but here's the first huge point you need to grasp. Vitamin B3 isn't just one thing. It's like a family name for several different compounds.
A family. Okay, I didn't know that.
Yeah. The main ones you find in supplements are niacin, that's also called nicotinic acid. Then there's niacinamide, sometimes called nicotinamide, also nicotinamide riboside, and inositol hexanocotinate.
Whoa, okay. 4 types. That's already more complicated.
Exactly. And each one acts differently in the body. They have different effects and, crucially, very different side effect profiles.
So if Elisa's mom just heard vitamin B3, how would she possibly know which of those 4 the video meant? Or which one is even relevant or safe? What does the actual research say about these specific types for glaucoma?
That is precisely the problem Professor Lin highlights. So niacinamide, that second one I mentioned, that's the one with the most research behind it for potential glaucoma neuroprotection. Nicotinamide riboside also has some studies.
Okay, niacinamide and nicotinamide riboside. Got it.
But here's the kicker, and it's really important. Even with that promising research, neither niacinamide nor nicotinamide riboside is currently approved by the FDA or, adopted by any standard medical institution as a routine treatment for glaucoma.
So it's like interesting science, maybe future potential, but not standard care right now.
Correct. Promising, but not proven or endorsed for general use yet.
So what are patients and doctors supposed to do then? Is there any official guidance?
Yes, there is. And this is where Professor Lin points to a really key document. The American Glaucoma Society and the American Academy of Ophthalmology put out a joint statement. It was in March 2025, specifically about using nicotinamide for glaucoma neuroprotection.
Okay, what'd they say?
Their recommendations are very, very clear. First, niacinamide is not approved for glaucoma treatment. Second, its long-term safety, still unclear.
Right. Makes sense if it's not approved.
And if someone is thinking about taking it, specifically doses below 3 grams per day, they absolutely must work with their primary care doctor. And they need regular liver function tests.
Liver tests. Okay, so that concern Elisa had was definitely valid.
Extremely valid. And for higher doses, 3 grams a day or more, the recommendation is don't take it unless you're part of a very closely monitored clinical trial. The risk of drug-induced liver injury is just too significant.
Wow.
Also, anyone with a history of liver problems or current liver disease, they shouldn't supplement with niacinamide at all, period.
That's incredibly specific, and this really brings Professor Lin's warning about severe consequences of taking the wrong B3 into focus, right? Because you mentioned niacin and niacinamide.
Yeah.
They aren't the same thing.
Not at all. They are absolutely not interchangeable. And this is the absolute heart of Professor Lin's warning. Niacin, the other common form, has not been tested in human glaucoma trials for neuroprotection.
Oh.
What's more, niacin is actually known to be potentially toxic to the liver at high doses.
So taking niacin thinking it's the helpful B3 for glaucoma could actually be harmful.
Precisely. That's why these professional bodies strongly advise against using niacin for glaucoma neuroprotection. It just hasn't been studied for that, and it carries known risks.
Okay, that completely changes the game from just take vitamin B3.
It really does, and it also shatters that common myth. Professor Lin often tackles the idea that water-soluble vitamins are always safe, that you just, pee out the excess.
Right, I've heard that.
It's not true. Professor Lin has pointed out examples like B-complex vitamins or even vitamin B6 causing toxicity issues. So water-soluble doesn't automatically mean risk-free.
This whole discussion really highlights how vital critical thinking is when we see health claims, especially online or on social media. It's clearly not enough to hear vitamin B3 helps glaucoma.
Not even close. You absolutely need to know which specific form of B3 they're talking about, at what dosage, under whose medical supervision. And you have to be fully aware of the potential risks and the contraindications, like that liver issue.
The nuances aren't just minor details. They're crucial for your safety.
Exactly. It matters profoundly for your actual health outcomes.
So the big takeaway for you listening is this. Even advice that sounds simple and helpful, like take a vitamin, can hide really complex, really important details, details that seriously affect your safety well-being.
Yeah.
The point isn't that research is bad or that we shouldn't look into new possibilities, not at all, but it's that discernment, careful checking and getting guidance from trusted, verified experts is absolutely essential.
Couldn't agree more. And maybe that leaves you with something to think about. In this age where we're bombarded with information, with really slick, compelling social media videos, how do you personally check health claims before you even consider them for yourself? What steps can you actually take to make sure you're telling the difference between, say, exciting early research and established, proven medical advice, especially, when it's your own health on the line?